Hello, everyone. I am Bert Eichel, the Health Officer of Mobile County, and it's a pleasure to talk to you today about COVID 19. We have had significant improvement in disease transmission rates in Mobile County since earlier in August. On August the 17th, we had 486 persons in the hospital with COVID. Today, we have 138 persons in the hospital with COVID. Significant improvement, and I really want to thank all the medical professionals, all the hospitalists, our ambulance drivers, everybody who has responded in such a dynamic way to help the people of Mobile County with their health care and help control COVID 19. Unfortunately, in the past 2 days, 39 individuals have died from COVID. 90% of them, so if we do the math, 36 out of the 39 were not vaccinated. That is a terrible loss, and I really feel sadness for the families who have lost family members and loved ones and friends to COVID 19. The numbers are getting better, but it is not over. So please, Mobile, do not do what we did at the Memorial Day holiday. Everybody was tired of COVID. Everybody had been being real good about wearing masks and distancing. The community transmission rates went down. Everybody just thought it was over. And we went through a tremendous medical crisis for the past 6 weeks or so. So let's all continue to be moderate in our social activities. Let's try to continue to vaccinate. If you're around people who you don't know their vaccine status, please wear a mask. The masks do work. And we have to commend our school commissioners because having masking in place for schools has really helped decrease the community transmission rates. So as we go forward, we're at a high point on on August of 31% of the COVID tests were positive. Right now, we're at 15% of our COVID tests are positive. When we began the Memorial Day holiday, we were around 4% of our COVID tests were positive, and we recommended people not be as cautious as they were, but we did not encourage anybody to just have unchecked behavior. So my recommendations to our Mobile community is number one, thanks to our healthcare professionals who have done an outstanding job. Number two, those who are not vaccinated, please get vaccinated. If you have friends and loved ones who are not vaccinated, please again encourage them to get vaccinated. In the last 2 days, 36 people died in Mobile County who were not vaccinated. That loss of life can be prevented, and we highly recommend in public health that you get vaccinated and be cautious. Again, thank you for your changes in behavior as we've now got a decrease in community transmission. Our goal is for 80%, repeat, 80% of the population to receive vaccination. And at that point in time, we will consider our community as having herd immunity. We have about 41% of the population is partially vaccinated. So if you've had one shot, please get your second shot. If you haven't had any injections, please go get your first one. But that's the most important thing you can do for your family, your friends, your loved ones. We don't need any more funerals in Mobile County, Alabama from COVID 19. So stay safe. We will get through this. It has been very tiring and very hard on everyone, but together we can outwit COVID 19 by being vaccinated. So I'd like to turn it over to Dr. Rendy Murphy, who's our regular on Facebook Live. And again, everybody stay safe. We will get through this. We've got a little bit more time to go, but vaccinations are the key to the ending of COVID 19.
Thank you, Dr. Eishold. It's always a special treat to have our health officer addressing us directly when it comes to what's happening out there and around town. So thank you, and thank you for your service to the community and to the employees of MCHD. We're a big family here, and we are all pulling each other up to keep going against COVID-19. So just briefly, I'll just restate the numbers. We added 176 cases of COVID-19 yesterday. That brings our total to 70,635. 19 deaths were reported to us yesterday, so a total number that have died is 1,210. I think I've said this before, that August is going to end up being the most deadly month for Mobile County in the entire COVID outbreak. It's going to tower over other months like December and January, where we saw a lot of deaths, but not anything like we have just experienced. 21 new patients in the hospital have been diagnosed with COVID-19. That brings the total to 8,677. And yesterday, there were less than 150 people in the hospital, so 149 people. That is really good news. We know that a lot of those people are not leaving the hospital alive, and as Dr. Eishold mentioned, that is just an extremely unfortunate event because 90% of them or greater are unvaccinated, and we have a very safe and effective vaccine for preventing hospitalizations and deaths. So those are preventable deaths, and we just want to continue to encourage people to get vaccinated, even if you think that you are a healthy person and you're not going to get sick or need hospitalization or die from COVID. You getting vaccinated help protects our community. And so you could help us keep that number down by getting vaccinated on behalf of your family, your coworkers, your community. So just a couple other things to mention. Still, we're seeing about 20 to 25% of the cases in children and very young people. So thanks again to schools who are requiring masks and enforcing universal mask wear. That is definitely slowing things down, but we are still seeing a lot of children and younger people who are unvaccinated or too young to get vaccinated, getting COVID infections. And then the largest age group that is driving transmission is that 25 to 49 age group. So nearly 40% of all of the cases are in that age group. So get vaccinated to protect yourself from getting COVID infection, but then also if you do get COVID, to keep you out of the hospital or prevent you from dying. So a couple other just quick announcements, and then we have a few questions. The Alabama Department of Public Health released some information today, just again reminding people that COVID-19 continues to infect people in Alabama, and the Delta variant is still, nearly 95 to 99% of all of the COVID infections that we see out there. So, improvements in the number of cases reported, improvements in hospitalizations, improvements in the percent test positive, those are all good things, but we are not out of the woods. It will take us still a while to get back to enjoying 3 to 4% positive, low double digits of people in the hospital each day. That's what we had in June. And then because we couldn't get enough people vaccinated and because we, abandoned mask wearing and distancing, we got ourselves into, the record breaking COVID outbreak that we experienced in July and August. So let's not put ourselves in that situation again. So please be vigilant in layering those prevention measures. So again, vaccination for those who are eligible, wearing a mask, keeping your distance from people that you don't know, avoiding large gatherings, particularly indoor gatherings. Also, another treatment for COVID is the monoclonal antibody. You can get that two ways. That can be delivered to you intravenously or through a subcutaneous injection. And there are two different products that are FDA authorized for treatment of COVID if you get infected and you are not vaccinated. So the Mobile County Health Department is pleased to open our monoclonal antibody injection clinic, open that to the public. We had been addressing and dealing with our own patients and people that test at our clinics, but we have capacity now to open that up to others. So in the news release today, we're excited that we can provide this service. It's a subcutaneous injection. It's a shorter needle. It goes into between your skin and your muscle, so not into your vein. It is 4 injections, but it's not as scary as it sounds. And if you're not vaccinated and you test positive for COVID and you are at high risk for severe disease, please call our appointment line at 251-690-8889. They will get you an appointment with someone who can review your medical history and find out if you're eligible for a no cost to you antibody injection treatment. So very happy to open up that to the larger community. So again, it's at our clinic on Dolphin Island Parkway, but you must call 690-8889 to see about getting an appointment to speak to someone to see if you're eligible for receiving treatment there. I have a list of questions here. I just wanted to comment. There are a couple of news stations that often rebroadcast this Facebook Live broadcast, and if you post your questions on there, we don't answer those. So if you post it on KRG or PMI or some place where they rebroadcast this Facebook Live, then if you post your questions there, we're not going to see those to answer them. So please, if you have questions, go to I Heart MCHD. I love MCHD. Which is it, James? I love MCHD. So go to I Love MCHD on Facebook and like us and follow us and post your questions there, and that's where the questions come from that I address during the day. So a couple of media questions. A news station noticing that the numbers are trending down. Is this good news? Could we finally be rounding the corner on this? It is good news that the number of cases and hospitalizations and percent positive are all going down, all going in the right direction, but we have not hit our low point yet. We've still got some time, a lot of work to do before we get down to the very low level of transmission that we enjoyed in May and June. So keep up, get vaccinated, wear your mask, distance, stay at home if you're sick. Am I worried that people will let their guard down? I'm always worried that people will let their guard down. Always worried that they will. And, I've talked to a lot of younger people who say, well, I'm a healthy person. I don't really need to get vaccinated. And, I remind them that sometimes when you're in college or in your early 20s and 30s, you sometimes get out of routine health care. You don't go to the doctor on a regular basis maybe, and you may have an underlying medical condition that's you don't even recognize, maybe hypertension. People who are overweight or don't recognize that as being a risk factor for severe disease should you get COVID. So just remind everyone not to take not to take your good health for granted. And if you have any concern for the health of your community, then that's another reason to get vaccinated. So don't let your guard down. Get vaccinated, wear your mask, and keep your distance from people that you don't know. So we are on the other side of the July-August peak in that very historic wave of COVID-19, which was driven by the Delta variant and by low vaccination rates. But Delta is still a great threat to us. Again, it is still 95 to 99% of the infections that we see out there. We're very fortunate that the test for COVID recognized the Delta. The vaccine works well against Delta. Some of our treatments, like the monoclonal antibody treatments, work well against Delta. So those are good things. But we should still be vigilant about protecting ourselves with those layered prevention measures. All right. About vaccination efforts, we are almost at 40% fully vaccinated. That is good, but it means that the majority of Mobile County residents are still not vaccinated. So until we can flip-flop that, where we have the majority vaccinated and minority unvaccinated, I don't think we're going to be getting closer to herd immunity. Yes, we're at 40%, which is good, but we still have such a long way to go before we hit that 70 to 80% of herd immunity that would protect our community potentially from another variant as infectious or as Delta. Let's see. Someone asking about a Labor Day spike. If we were going to see a spike or a bump in cases because of Labor Day, we would have already seen it. Myself, Dr. Eishold, other public health officials, we have talked about how we're a little bit sort of confused about this, don't quite know what to think of it. So we didn't see a huge spike after Labor Day, which is great. Hopefully it means that, our local schools requiring masks, hopefully that's, helping to control transmission. Hopefully the people that are not vaccinated are layering on some of those prevention measures. But yes, we are on the other side of our historic outbreak in July and August, but we're still going to be a couple of weeks out before we have an opportunity to get down to very low, and we're only going to get there if we can continue keeping our prevention measures in force. All right, any concerns about Thanksgiving and the holidays? Yes, we are always concerned about things that will bring us together indoors with people that may not be vaccinated, so it is a concern. Last year, we were surprised but very fortunate to see that we had almost no seasonal influenza last year, because if you remember, there was a mask mandate. A lot of schools were out of session. We had limits on occupancy, those sorts of things. And so we had almost no seasonal influenza last winter. But those things aren't in place this year. And it is a little nerve-wracking to think what might happen this year if we have a serious seasonal flu or, a lot of influenza mixed with a lot of COVID-19. So please get your flu shot. They're ready. They're out there already. So please go ahead and get your flu shot and get vaccinated. There's no reason to space those apart. You can get your flu vax and your COVID vax at the same time if the clinic offers that. All right, is there data on myocarditis from the virus? I've mentioned that the virus has higher rate of myocarditis than the vaccine overall, seems to infect younger individuals. Okay, here's what I know. So yes, myocarditis or inflammation of the lining or the exterior lining of the heart has been shown to be, or is thought to be, connected to vaccine about a month after a young male particularly gets vaccinated. So not an immediate side effect, but a little bit delayed, a couple of weeks delayed. It's the sort of the pathology or the cause and effect is not really worked out yet, but at least there appears to be some connection between vaccination and young men. But that risk is not serious enough to cause the Advisory Committee on Immunizations Practices to recommend deference of vaccination. So that means that risk of myocarditis from vaccine does not outweigh the risk of getting COVID. So still, illness and complications and the chance that you could have myocarditis from getting the disease is still more serious or has a bigger impact than the relationship between vaccine and myocarditis. Again, so there's still a recommendation for taking the vaccine, even if you are a younger male, but we just want to, maybe keep a close eye on you and go, seek treatment if you start to have some signs, some chest pains, that sort of thing, shortness of breath. All right. Someone saying that they had a Pfizer vaccine, can they get a Moderna booster? Right now, the only thing that is authorized is a third dose, not a booster, a third dose for Moderna and Pfizer, and you stick with the same product. That is what is authorized at this point. So a third dose of Moderna or Pfizer for immunocompromised individuals, and you get the same product as you did your first two doses. Now, this brings me to what is happening right now in Atlanta at the ACIP meeting, is that they are reviewing the evidence for a booster dose of Pfizer. only Pfizer, and this is for a booster dose. So this would be, well, we don't know exactly who it's going to be recommended for. FDA suggested that it be for people 65 and over, those who are at risk of serious complications from COVID disease, and people who are at risk of getting COVID in occupational settings, so healthcare workers, first responders, that sort of thing. So ACIP is currently drafting recommendations. I think they will vote today or maybe first thing tomorrow. We will know tomorrow what ACIP and CDC recommend and what will be authorized for a booster dose. So, and if you thought things have been confusing in the past, just hang on, because it's going to be very, very confusing when we have authorizations for some people to get 3 doses and not others. And so, what's the difference between a third dose and a booster dose? So we'll probably continue talking about this even when I see you on Monday. So that's it for today, unless there are any questions. Nope, no questions. All right. So we'll end our broadcast today. Again, thanks for what you're doing out there to keep yourself and your family and your community safe. Please get a vaccine if you have not begun your series. Please do it as soon as you can. And then continue to mask and distance to protect yourself from COVID transmission. And we'll talk to you again on Monday.